Hello, this is a quick follow-up to yesterday's video about the difference between lumbar flexion and posteriorly tilting your pelvis. These movements are often coupled. However, they are actually two different actions. So the lumbar spine can move relative to the pelvis, and the pelvis can move relative to the lumbar spine. The lumbar spine, remember, is the area below your ribs. So it's typically five pretty broad vertebrae that connect the base of the pelvis, the sacrum, to the rib cage. And there's a fair amount of flexion and extension that can occur through there. There's also some rotation that occurs through there. From a side position, if I think about the area just above my belly button, just above, down to right below my belly button, if I think about moving that back towards the wall behind me and then moving it forward, I am moving my lumbar spine, and you'll see when I move that area back, my pelvis isn't changing shape. I'm keeping my pelvis where it is, and you'll see that my lumbar curve flattens out significantly. As I mentioned yesterday, we all have different degrees of natural extension in that area. I happen to have a fair amount. If I move my pelvis relative to my thoracic spine, or sorry, to my lumbar spine, it looks a little different. So I can keep my lumbar spine exactly where it is, and I can change the position of my pelvis. I can put the two motions together. I can posteriorly tilt and flex. Posteriorly tilt and flex. Now the same is true with anterior pelvic tilting and extending. I can move the lumbar spine into extension relative to the pelvis. My pelvis doesn't need to change shape as I do this. Or I can anteriorly tilt my pelvis relative to my lumbar spine. Two different actions. Or I can put them together, right? Which is what we often think of. This is the thing that we tend to get kind of fixated on. But if you're not looking at how the bones are moving relative to each other, you might be fixating on the wrong thing. You can look at the same thing in hands and knees position. Sometimes that's a little more clear. So if I come into a hands and knees position and I think about moving that same area, so I'm thinking like right above my belly button to right, like right below my belly button, and moving that up towards the ceiling and down towards the floor. And I'm trying to keep my pelvis in the same place. It's not moving. I'm just trying to move that lumbar spine. It's hard for me because, like I said, I have a fair amount of extension. I don't have a lot of flexion. I can also move my pelvis relative to my thoracic spine, or to my lumbar spine, keeping that area really still. Or I can put them together, again, which is how we often think of this, is this coupled action. When you are looking at coordinated movement, it's great. Well, it's great. It's good to see how things are moving relative to the area above and below. And if you have an area that's really connected, like if you have no differentiation between the lumbar spine movement and the pelvis movement, if whenever one moves, the other one immediately goes, then that can affect how things coordinate and how load is transferred all the way up the kinetic chain. So learning to look for differentiation between these areas can be helpful. All right, I hope that makes sense. And as always, if you have any questions, just ask. Thank you.